The first thing to recognize when speaking of depression and the different treatments for it is that there are different types of depression. Each of these types might require a different treatment in order to alleviate symptoms and cure the disease. Depression and suicide are very much connected to each other. Often patients who try to commit suicide are diagnosed with some form of depression or mental disorder like trauma. A major event in a person's life can result in reactive depression. This is when a person physically and psychologically reacts to a problem in an extreme way. Post-traumatic stress disorder is an example. This can result in a cycle of negative symptoms. Talking therapy is a very good way of treating depression of this type. The therapy could be with a counselor or a psychologist. It could be in a group setting or it could be one-on-one. Additionally, an antidepressant might be prescribed. A chemical imbalance in the body can result in what is called endogenous depression. Talking therapies are required, but this form of depression is a lot harder to treat than reactive depression. In the first instance, your doctor might prescribe a number of different antidepressants. This will help bring you to the point of feeling sufficiently motivated to take part in counseling sessions. Another form of depression is postnatal depression. If the mother wishes to continue breastfeeding throughout the treatment, it can be difficult. The medication would then be transferred to the baby through the mother's milk. Depending on how severe the depression is, the mother might be admitted to a clinic, providing there is a mother and baby unit. When treating this form of depression, it is best to keep the mother and baby together so that their bonding process continues. These days, something that is used as ECT, electrocompulsive therapy. This is only be used as a last resort after a patient has been on at least 3 different antidepressant medications without results. In order to increase the chances of treatments being successful, lifestyle changes must be made. It is advised that a balanced diet and abstaining from drinking alcohol will help the recovery process during treatment. Acknowledging depression and seeking treatment does prevent suicide. Educating people in a positive way as well as providing useful information about mental disorders and health issues is important. The above-mentioned methods are the most common ways to medically treat patients suffering from depression. However, aside from these, there is also a host of alternative therapies available.